So I will just briefly talk a bit about the healthcare system where I'm a CEO. It's in the Stockholm region in Sweden, and it's a little it's way up in the northern parts of the Stockholm county, and we have a unique Thiohundra model. It's an integrated care model which is unique in Sweden, where we have integrated for now 20 years. We have integrated the healthcare system, the hospital system, with the elderly homes and the care system. So in my company, I have Norrtälje Hospital, which is a quite small general hospital. We have 6 primary care units. We have the psychiatry, and then we have 10 elderly homes. We have home care, and we have care for the disabled. So I'm in charge of this integrated care system, where we try to focus especially within the complex patients, frail elderly, and also people with complex diseases, psychiatric disorders, and things like that. And one of the most important goals is to treat the patients in their homes, in their elderly homes, and try to avoid patients coming to Norrtälje Hospital, the general hospital, if it's not necessary. Of course, if you have a heart attack or a stroke, or you have a fracture, you have to come into the hospital. But we try to keep the patients out in their homes as much as possible. So with the COVID-19 situation and in the corona pandemic, we have seen this year that this model, this integrated care model, has been very, very effective, and we have been able to reduce the number of deaths in COVID-19 in the acute phase during the spring of this year. As you might know, Sweden and especially the Stockholm area has been a big spread of the virus in March this year, where a lot of patients came home from Italy and from Europe and brought the COVID disease to the Stockholm area particularly, and a lot of deaths were happening, especially in the frail elderly group, in the elderly homes. So we did not manage to keep, in general in the Stockholm area, we did not manage to keep the virus disease out from the elderly homes. And a lot of the problems in Stockholm in general was and is still that we don't have the medical support in the elderly homes, because the division between the regions who provide hospital care and things like that, and the social side, the elderly homes and the home care. In my system in Norrtälje, we have the integrated system, and very, very early in the beginning of March, because I'm a medical doctor, and we have medical doctors in the management, in the leadership group, and nurses, we very early increased our efforts in the elderly homes and in the home care, so that we could very quickly help the staff in the elderly homes with hygiene precautions and to help them to deal with the disease. So in that respect, we isolated the homes very early, the elderly homes very early, and so the disease, the COVID-19, did not enter the elderly homes in our part of the Stockholm area. And we can now see that we have had very few deaths in our elderly homes up in the Norrtälje area where my company is. And unfortunately, in the rest of the Stockholm area, we did not have this quick and the fast and good integration, and so we could see a lot of spreading in the virus in those elderly homes, and unfortunately also quite a high number of casualties and deaths in that respect. And we did many things very early. We have a mobile team from the Norrtälje General Hospital, doctors and nurses, who also identified a number of frail elderly patients who usually come into the hospital for care. And with the mobile team, we were able to go out to those patients, especially patients with chronic heart failure and pulmonary problems. We could go into their homes and treat them and taking care of them, supporting them, so that they would not come to the Norrtälje Hospital if it was not absolutely necessary. And in that respect, we could keep a lot of patients away from the hospital, so they were not diseased with the COVID-19, and also the staff and things like that in the Norrtälje, in the hospital, they kept up from the virus. So the mobile team from the hospital, I think, is a very good way of dealing with the chronic frail elderly patients, especially in the pandemic situation, but also if you in the ordinary situation, because we don't want the frail dementia patients, for instance, coming into the hospital unless it's really necessary. So these were a few of the precautions we did very early, and also, of course, the digitalization. We have worked many years with digitalization, and we try to have more and more digital visits with our doctors, with our nurses from the hospital, the rehab teams. And now through the pandemic, or because of the pandemic, we have increased the number of digital visits, telephone visits and things like that very quickly and very fast. And also through the digitalization, we have been able to keep the patients away from the primary care units, from the hospital, and we have managed also to lower the COVID-19 situation. And the interesting part is also that the hospital staff, they have found this way of working through the new digitalization or the mobile team, things like that. It's a very effective way of working, and with also a lot of satisfaction that we take care of our patients in a much more effective way through this way. So now the second wave is coming to the Stockholm area, as in big parts of the rest of the world, and we now have a much better situation in the second wave, working with our digitalization, with our mobile team, and we have also very good collaboration in the Stockholm area with the other hospitals. So we have actually created a much better integration between the hospitals, Karolinska University Hospital, the other big hospitals in the Stockholm area, trying to work together and also increase the number of ICU beds. We did that in the spring, and we did that also now in the fall, in a very effective way, learning from each other and collaborating in a very, very good way. So I think the pandemic situation has been very tough for Sweden and for many, many other countries. The Stockholm area has been very affected, but it has also taught us the importance of working together in more of an integrated way. In Sweden, one of the problems in the healthcare system, or I mean, in the elderly homes and in the home care setting, in the municipality, is, as I said in the beginning, the lack of medical support. And one of the big take-home knowledge is now that we have to be much better and increase the education in the staff in the elderly homes and in the home care setting. So I think I will stop here. This was the most important tasks for me to convey to you, that the integrated care model, especially for the complex and the chronic patients, has been very successful fighting the corona pandemic situation, but I think it can be equally useful also without the pandemic situation to treat the chronic patients in a special way through better integration between the healthcare system and the home care situation in the elderly homes. Thank you very much.